My name is John Norcini, and I'm looking forward to seeing you in October. In the meantime, we thought it might be useful if I shared some technical material with you. So what I'm going to do today is provide a little bit of background about what a test or assessment is. There's lots of confusion over the terminology. I'll talk about how assessment affects learners, how assessments are changing, and who cares about assessment. And then I'll talk a little bit about the characteristics of good assessment, how they relate to purpose, and how they relate to different stakeholders. If you go to the dictionary and look up the word test, you'll find two different definitions. The first definition is to discover the worth of something by trial. Some folks refer to this as summative. Other folks refer to this as evaluation. For us today, I'm going to be talking about this as summative assessment. And it's the kind of assessment that's done at the end of a course, at the end of a year. This is the kind of assessment done by regulatory bodies. It's discovering whether a student has learned enough to progress to the next stage of their careers. Second definition for a test is to improve the quality of something by trial. Some folks refer to this as formative. Other folks refer to this as assessment. I'm going to talk about it as formative assessment. This is the kind of assessment that's done in order to provide feedback to students to help them in their learning. So for our purposes today, a test or an assessment is any measurement process. And those measurement processes have one of two purposes. Either they're used for formative assessment, which is to support learning, or they're used for summative assessment, which is to establish whether students have learned enough. These two kinds of assessments are central to understanding the importance of assessment, to understanding how assessment's applied, and also to identifying the criteria for good assessment. Assessment, as you all know, is an incredibly powerful tool in education. It motivates students to learn. It directs their learning by signaling what's important. It ensures that learning has occurred, and it creates learning. If you go back 50 years and you look at the kinds of assessment that was done, mostly multiple choice questions, essay questions, there was little realism in the kind of testing that was being conducted. Fast forward to today, and you find all sorts of simulations, standardized patients, workplace-based assessment. So compared to 50 years ago, assessment today is much more authentic. It also involves, more often, patients and members of the healthcare team in the assessment process. This simply wasn't done 50 years ago. Again, if you go back 50 years, there was little structure during clinical training, and continuing education, to the degree that it existed at all, was episodic and infrequent. Again, moving forward to today, clinical training is much more structured, and lifelong learning and quality improvement are important aspects of assessment. There are a number of different groups who have a stake in assessment. They all have a slightly different perspective on which part of it is important, but they all care. So for students, assessment is the key to learning and to the demonstration of competence. For teachers and for individual institutions or institutions in a collective, it offers the opportunity for accountability and self-assessment. For patients and other healthcare providers and healthcare systems, it's a means of accountability and also a means of improving the efficiency of healthcare. And for regulatory bodies, it's a means of establishing accountability as well, but also assuring the maintenance of competence throughout the career of healthcare professionals. Given the various perspectives of these stakeholders and the different purposes of assessment, it'll come as no surprise to you that the criteria for good assessment will vary with each of these. So different purposes lead to different values for the criteria. Likewise, different stakeholders and different mixes of stakeholders may value the criteria differently. So in 2010, a group of health professions educators from around the world came together at the Ottawa conference and produced a white paper which contained a set of criteria for good assessment and how they're modified by purpose and stakeholders. So what I'll do for the last 5 minutes is go through those criteria and then talk about how they are viewed by different stakeholders and for different test purposes. The first characteristic, and probably the most important of good assessment, is validity or coherence. Is there a body of evidence that supports the use of an assessment for a particular purpose? This is a property of the scores or the inferences based on the scores, not of the test itself. So it's not that a test is valid or invalid, but the scores are more or less valid. And it's also a matter of degree. It's not an absolute. Second characteristic is reliability or reproducibility. If you had a group of students and you gave them a test and they learned nothing for 2 weeks and then you gave them the test again, ideally you'd like them to get exactly the same score on the test. This is called reliability or reproducibility. There are a whole raft of ways to calculate this, but the bottom line is that it's a way of assuring that test scores are consistent or reproducible over time. The third characteristic of good assessment is equivalence. Different versions of an assessment should yield equivalent scores or decisions. It wouldn't be very helpful if 1 year a test was very easy, the next year it was very hard, so that all the examinees were treated unfairly, depending on whether they took the examination that was too easy or too hard. The fourth effect is a catalytic effect. Assessment provides results and feedback in a fashion that enhances learning. Clearly, this is a requirement for formative assessment, probably not so important for summative assessment. The fifth characteristic of good testing is the educational effect. Clearly, assessment motivates those who take it to prepare in a particular fashion, and that has some educational benefit. So for example, if you gave students a multiple choice examination, they would go to the library and study. On the other hand, if you gave them an examination composed of standardized patients, they'd go to the sim lab or to the bedside to learn clinical skills. So whatever test you choose, it has an educational effect. The sixth characteristic is acceptability. It's clearly important that different stakeholders find the assessment process and results to be credible. And the last characteristic of good assessment is feasibility. The test is practical, realistic, and sensible given the circumstances and the context. This slide shows the 7 characteristics of good assessment and how they might vary a little bit in importance from formative to summative assessment. So for summative assessment, where a career may be on the line, where the stakes are relatively high, the technical characteristics of the test are much more important: validity, reproducibility, and equivalence. On the other hand, in terms of formative assessment, which is intended to give feedback to create learning, characteristics like the catalytic effect, the educational effect, feasibility are much more important. This slide shows from the perspective of the examinees which of the characteristics are most valuable in terms of formative assessment and summative assessment. Not surprisingly, from the perspective of the examinee, the technical characteristics of the test, like validity, reproducibility, and equivalence, are most important for summative assessment. These are high-stakes decisions. The examinees want to be treated fairly. On the other hand, for formative assessment, where the goal is feedback to the trainees, catalytic effect, educational effect, acceptability tend to be more important. For teachers and institutions, this slide shows how they value the various criteria for both formative and summative assessment, and it's very much the same as it was for the students. For summative assessment, teachers and their institutions value the technical characteristics most highly: validity, reproducibility, equivalence. But for formative assessment intended for educational purposes, clearly the catalytic effect, educational effect, feasibility, and acceptability are more important. For the patients and the healthcare system, and other persons involved, healthcare providers involved in the process, the distinctions between formative and summative assessment become less important. For these groups who are concerned with using the abilities of healthcare providers, formative assessment is nice, it's a luxury, it's good, but their primary focus is on summative assessment and the characteristics that would be useful in determining the quality of the products that they will be encountering in the health system. So for both, the technical characteristics of testing, validity, reliability, equivalence, are going to be most important. The educationally driven characteristics of a test, like catalytic effect, feasibility, acceptability, educational effect, are less important. The exception is healthcare systems are increasingly becoming involved in the ongoing education of providers in their systems. And finally, regulators are most concerned, again, with the technical characteristics of the test, given their need to be accountable to the public. So they care about validity, reproducibility, and equivalence. Again, in contrast to several years ago, however, these regulatory bodies are much more involved in the education of providers. Consequently, things like the catalytic effect, feasibility, and acceptability are becoming more important. So in summary, there are 7 characteristics of good assessment: validity, reliability, equivalence, catalytic effect, educational effect, acceptability, and feasibility. These are clearly influenced by the purpose of the test. The value for each of these characteristics differs if the purpose of the test is to provide feedback to the folks who are taking the test, as opposed to making a decision about whether they can progress on to the next stage of their training. Likewise, the value of each of the criteria is influenced by exactly who the stakeholders are: learners, teachers and their institutions, patients in the healthcare system, regulators. All have slightly different perspectives on what they value in assessment. I hope this has been helpful to get you started, and I look forward to seeing you and going through all this in October.